My name is Dr. Chet Kuntz, and I am a sports physiotherapist, founder and owner of Pr1me. And I've been helping runners deal and battle with plantar fasciitis for a long time now. And I want to help you guys avoid plantar fasciitis, not just during a long run, but in the long run, so that you guys could continue to run pain-free in your 40s or 50s or however old you aspire to keep running. So I've kind of created this really simple PowerPoint overlay for you guys to kind of keep things digestible and to kind of give you guys some thought as to what needs to occur. So let's kind of get into some considerations, or what are some factors that are playing a role that you need to be mindful of to help you minimize the chances of your plantar fasciitis ever coming back. So we're going to first just dive into external loading. What does external loading mean? Well, simply we can kind of quantify it down to what are we doing? So how many miles are you running per day, per week? Heck, how quickly did you ramp up? Not like this type of ramp, of course, but how quickly did you ramp up into that? Did we just decide, okay, I'm going from couch to 5K, and all of a sudden I'm running a 5K tomorrow and I haven't ran in 2 years? Or, well, I'm running 7-8 miles a day, but I want to run an ultra marathon, and now I'm doing 20, 25 all of a sudden. Or maybe it's not that exaggerated, but maybe you take it up from 5 to 7 miles a day to 20, maybe within a week, because you want to get running. You sign up for a triathlon. In a couple months, your friends talked you into it, and you know that you're going to be weak in running, so you're going to just ramp it up. Or all of a sudden you're like, yeah, I'm going to just go for a marathon in a month, and let's see what happens. So that needs to be a strong consideration for the generation of plantar fasciitis. Let me just pause there and we'll kind of get into it. How many rest breaks per year? So a lot of you runners aren't taking any rest breaks like ever, which is kind of why I like working with you runners, because you guys are motivated. Nothing will stop you. Nothing will hold you down. You're going to run, run, run. But at the same time, we've got to be smart about it. So this all falls underneath external loading in my book. Microtraumatically, something's going to probably give in. Unfortunately, and maybe based upon the way you're running or various other factors, you develop plantar fasciitis is the third most common lower extremity injury in runners from an overuse injury. So how many times are we really providing rest breaks? And not even with regards to cross-training or anything like that, but just giving it a chance to breathe. Give your body a chance to breathe. I've worked with quite a few runners. They're running from the past. They're running from bad finances, and there are stresses that they deal with every day. And so they have to combat that distressor with a eustressor with running. But the problem is your plantar fasciitis doesn't really care about what you're running away from. It just cares that it needs a break. So we've got to find the root of the cause of the problem, give you other stress-relieving techniques. If you need to keep up with your cardiopulmonary endurance, get on the bike, get swimming, but you've got to find a way to let the plantar fasciitis, or whatever the problem is, recover. What shoe wear are we having? So shoes should be replaced if you're a pretty serious runner. In my book, every 3 to 6 months. I've worked with multiple runners that are running with shoes that have been there for 3 to 6 years. It's kind of like, well, that shoe's not going to really support you. Others are wearing minimalist shoes, and some run without anything. I think that's a different story. For those of you that are running with shoes, your body's somewhat conditioned to that. We need to change them out every 3 to 6 months. Strength program. Running is a sagittal sport. You run forwards. That's it. Your hips become deconditioned, and that's almost something I do with almost every one of my runners. We need to get our hips firing. We need to get our hips stronger. Do we have a strength and conditioning program that's complementary to our running? Do we have a running specific workout program in the off season? Do we have an off season? These are all questions that are a strong consideration for your plantar fascia. Notice that I've barely spoken to plantar fascia here, yet we're talking about staying away from plantar fasciitis all your life. It's because it's just where the pain is. You need to bring about a very strong body in almost every way, an intelligent, thought-out plan to stay away from plantar fasciitis. Running style. I'll probably get myself in trouble here, but I don't care because it's what I've seen anecdotally help so many of my countless runners. I actually first started working with runners out in Arizona when I was doing an orthopedic residency program, and I became the runner guy. I was working with people who are running 55Ks, and guess what? I really haven't done too well with anyone that's wanting to solely commit to a 4-foot striker. Almost everyone in my book eventually becomes some form of a heel striker, if nothing else, mid-foot striker. I'm going to have another video coming out on why that is, but I can tell you anecdotally, almost no one succeeded consistently for a long period of time who's been a 4-foot striker. The Boston Marathon shows a good example of this. About 90% of you start as a heel striker if you participated in the Boston Marathon. By the end of the race, 100% of people were heel strikers. 100%. That means if you're a 4-foot striker, you just couldn't last with that technique. You gave in to whatever your body was easiest, and that's what a heel strike was. That's because it's more ergonomic and more efficient. But again, we'll touch on that later. Also, if you're an upright runner, a lot of people tend to be very vertical in their running style. If they're upright, it's best to have about a 10 to 20 degree lean. So your running form can mean everything if you're developing consistent plantar fasciitis. Do you have proper warm-up or cool-downs? Or are you just late to the meeting and you go, oh crap, let's just go. All right, let's hit 10 miles. All right, are we cooling down properly? Are we addressing our areas that are traditionally tight afterwards? I like to really stretch hard afterwards. I like a little bit more of a dynamic warm-up before. I like to think about getting the hips going a little bit more. Are we doing that? Are we just, again, running late for our 6 a.m. crew on Saturday mornings? You go, oh shit, let's get running. And all of a sudden you just get into it, and 5 miles in, you're starting to feel your same plantar fasciitis. We've got to be smart about that. And are we consistently addressing weak spots? I don't care what you do, whether you're a runner, a power lifter, a tennis player, we have to consistently find where you're weakest, both sport-specific and anatomically. We need to be consistently addressing it, and if we want to have lofty goals like running, let's say 100 miles a week, I'm with you. But we've got to put in a lot of work if you want to address that lofty goal. We're going to have to find where you're weakest and continue to work on that, whether it's soft tissue work, whether you are stretching, whether you are strengthening it, whatever that is that's addressing your weak spot. We need to have that continued to be done if you're really in the heat of the season working hard. Cross-training too. This kind of goes a little bit along with the lines of our strengthening phase. But it's really important to do some form of cross-training. Now, if you're really into endurance and you need to get that run in, you can still do that, but have some moments where you're doing some sort of cross-training. Maybe it is a mud runner. Maybe you're doing some CrossFit. Maybe you're doing some weight training. Maybe you're swimming a lot more. But cross-training is incredibly important for the body because the body is, fortunately and unfortunately, incredibly good at adapting specifically to the environment you're giving it. So if you're only giving it running, it will adapt to that exclusively, which can actually have problems. You need to cross-train and kind of trick the body and trick the brain a little bit. And at the end of the day, we have to keep the fascia incredibly strong and mobile. Almost everyone I know that has plantar fasciitis, they're already kind of doing like some sort of rolling. They're getting like a water bottle and they're rolling it. They're stretching it like hell. They're wearing the socks. But very few of you are getting the fascia strong and mobile. Okay? It's got to be both. It's got to have great mobility and strength. I think that's incredibly important. In fact, I know it is because that's how I've helped a majority of my people continue to run in the long run, pain-free, and not come back for a year or 2 years because we're able to do all those things I just talked about as well as keep the fascia strong. And there's really no getting around it, all right? Keeping around with that as well as a good strength and conditioning program as well. If any of this resonated with you guys and you guys would like to get into touch with us, feel free to take our number down and reach out to us on the website. In fact, if you've seen this video, I'd like to extend to you a free runner's evaluation. We could figure out what your weak link is. We could sit down and talk to you and figure out what your problem is. We could get you on the treadmill. I know that's kind of weird for some of you running, but that's the best way that I can really analyze your running. Your style, your strategy. Let's sit down, and sometimes the gold is just in the conversations we're having about, your external loading, your type of approach to running. We can kind of go from there. So I hope this was helpful. Thank you guys so much. My name is Dr. Chad Kuntz. Take care.